shoulders. I don't see any atrophy. I don't see any deformity. Everything is equal and no bruising or anything. Now I'm going to go ahead and palpate. I'm going to go ahead and take her shoulder blades and go laterally. I'm going to find her AC and go immediately into the subclavicular notch. Everything on the shoulders. Doesn't show any pain, no swelling. Everything feels pretty good. Now I need to do a range of motion. Can you please stand up? Can you raise your arms over your head, please? Can you raise your arms back behind you? So that's extension. Can you raise you need to do abduction, so your arms to your side. Abduction, you need to do your arms over your shoulders. Excellent, excellent. Now I need to do hands internal rotation, so I need you to put your back behind. The other one, please. Okay, and then we need to do up towards the ceiling. And up towards the ceiling. And relax your arms. Thank you very much. Go ahead and have a seat. Just sit down right here. So she had a full range of motion, and it was all her movements were very fluid. I'm going to examine her elbow. First I'm going to look. I don't see any bumps, no bruises, no nodules. Looking at both elbows. Everything looks normal. I'm going to palpate the elbow. The oleocranial appears fine. There's no swelling or pain. And look at this one. And the elbow like that. Everything looks great. Now I need you to do your elbow exercises. Can you bend your elbows? Can you straighten your elbows? Extension. I need you to hold your elbows like that. And then supinate. And then pronate. That's excellent. It seems like she has a full range of motion. Everything moves real fluidly. I'm going to look at her wrists. And then look at. And I'm looking at her hands. I hope the hyperfinal is there's no flatness or thickening, no swelling or nodules. Look at your wrist again. Look at her hand. There's no swelling, no bumps, no lumps. Her abdominal and her hyperfinal looks great. Okay, now I'm going to palpate it. I'm getting the radial and the ulnar. I'm doing her whole snap box. Everything looks good. All her fingers. There's no nodules. There's no swelling. There doesn't seem to be anything there. No pain. Everything looks great on her hands. Now I want you to do your hands exercises. So we're going to hold your hands up. Flex down. Extend up. We're going to do the adduction, hands together. Abduction, hands apart. Wonderful range of motion. That looked really good. Can you go ahead and stand up for me? I need to look at you and walk towards me. Walk away. Okay, thank you. The hip seems to have a normal swing and sway when she walks. Her gait is even. She's about 2 inches apart on her heel to heel. Can you go ahead and lay down for me to palpate your ribs? I'm going to have her lay on her side, face this way. I'm palpating her iliac crest, her iliac tubercle, her anterior superior iliac, and her greater trochanter. Any pain? No pain, no swelling. Everything feels normal. Can you turn around for me, please? Once again, I'm going to go ahead and hit this iliac crest, iliac tubercle, anterior superior iliac spine, and greater trochanter. Once again, there's no pain, nothing like that. Can you lay flat on your back? Okay, I'm going to go ahead and do your range of motion exercises. Can you flex your legs? Flexion. Great. Extend. I need to do the extension, so please turn on your face flat. Now lift this. Do an extension. I want you to lift this knee up like the little dog. There we go. And the other one. Excellent, excellent. Okay, go ahead and move back to your leg. We're going to do the adduction and the abduction. First, we're going to do abduction. Away. There's no tightness. Away. That's great. Now we're going to do the abduction. Excellent, excellent. Adduction. Okay. Now I want you to lie flat and turn your lower leg and foot across the midline. Excellent. Other one.
Good. Now I want you to lie flat and turn it external. Good. Turn it. Excellent. Excellent. Everything looks good. I have a full range of motion. Very fluid movement. Now I'm going to go ahead and inspect her knees. And everything looks good. There's no swelling. They're well aligned. There doesn't appear to be any problems at all. I'm going to take a look at them. I'm going to palpate her knees. Can you sit on the edge for me? I'm going to palpate her knees, starting in looking at them. There's no bony deformity. There's no painful areas. The tendons all seem to be lined up. Okay, can you go ahead and lay flat again? I'm sorry, I appreciate your... Now I'm going to put pressure on here, and I want you to tighten your quads. Oh, excellent. The patellofemoral line is smooth and sliding. There doesn't seem to be any bumpiness or ridginess. I want you to go ahead and do a bulge test. So I'm going to start and work down. And work down on the other leg. No pleural effusion or any swelling located at all in the kneecap. Everything seemed pretty good. Now I want you to flex or bend your knee. Okay, great. Good. Straighten your knee, please. Okay, one more time. Okay, I don't feel any crepitus. Can you please sit up for me, ma'am? Go ahead and have a seat in the chair right here. Okay, now swing your leg internally. Okay, and externally. Wonderful. Okay, everything looks really good there. Check your ocular motor signs. We're going to do the 6 cardinal signs. When you see my fingers, I want you to say, look at my nose, say what?
Now. Now. Now.
Okay, her 6 cardinal directions are on sign. Now I want you to look at my finger and your eyes together. Check for convergence. I want you to look over my right shoulder. Look over my left shoulder. There is no nystagmus, and that's her trochlear. I want to check her trigeminal. Clench, please. Now I'm palpating her temporal and her masseter muscles. Clench, please. Okay, excellent. That's intact. I want you to hang your jaw low and go right to left, right to left. Everything looks good. Now I'm going to go ahead and look closely into your eye. Look at my nose. 1, 2, 3. Oh, okay, so her corneal reflex is in. Now I'm going to do her abducens. I want you to look at my finger. Right, left, right, left. Her lateral movement of her eyes are intact. We're going to check your facial nerves now. I want you to raise your eyebrows like you're surprised. Frown like you're mad. Close your eyes and keep them closed. Don't open them. Don't open them. Excellent. Show me your upper teeth. Show me your lower teeth. Okay? Now I want you to puff out your cheeks. Smile. Okay, it looks like our facial nerve is intact. I'm going to give you a little whisper test. I want you to tell me which ear you can hear me whispering. Excellent. Her acoustic nerve is intact. Now I want to check her glossopharyngeal. So I want you to say A, B, C, D.
A, B, C, D.
She has no hoarseness. Can you swallow? No difficulty swallowing. Her glossopharyngeal is intact. I want to check her vagus now. So I want you to open your mouth wide, and I want you to say ah.
Ah.
I'm going to gag you to see if you have an appropriate gag reflex. Open up. She does have a gag reflex. Okay, so now I'm going to check your accessory muscles, your accessory nerve. And what I want you to do is shrug your shoulders. Okay, she looks very symmetrical. I want you to turn your head against my hand. Turn your head against my hand. Once again, very symmetrical. It appears like her accessory nerve is intact. Now I want to check your hypoglossal. So I want you to just open your mouth and I'll look at your tongue. Okay, keep it in your mouth, please, ma'am. Okay, now stick it out. Her tongue is symmetrical and it doesn't have any trembling or shaking present. Now we're going to do alternating movements. What I want you to do is take your hand, touch your thigh, over and over, quick. Very good. Now let's do it with your other hand. Touch your thigh, quick, very good. Your movements are fluid and don't show any problems. Now I want you to tap your toes, tap, tap, tap. Okay, excellent, excellent. Her lower extremity toe tapping shows smooth movements and they are accurate. So now I want you to do point-to-point movement. I want you to touch your finger to my finger, touch your finger to your nose. Back and forth, back and forth. The other hand, please. Back and forth, back and forth. Patient's movements are symmetrical and smooth and very accurate. Now I want you to take your lower extremities and do this thing where you put your heel to your leg, shin, and run it up and down. Excellent. Your other heel to shin, up and down. Excellent. Then once again, it's smooth and very accurate. Now I want you to do your normal gait. Just walk towards me. Excellent. Walk back. Maybe a couple more steps. Good, good. Okay, now that seems to be good balance and accurate. I want you to stand up, and I want you to walk toe to heel to toe. Keep walking. Excellent. Okay, go ahead and step back. It shows smooth balance. Your tandem walking is in a straight line. Now I want you to walk on your heels. Excellent, excellent. Now I want you to go back here and then walk on your toes. Okay, she shows normal dorsi and plantar flexion. Plantar flexion. Go ahead and have a seat, ma'am. I appreciate that. I'd like you to close your eyes now tightly, and I want you to determine if this is sharp or dull. 1, 2, 3.
Dull.
1, 2, 3.
Sharp.
Okay, 1, 2, 3.
Dull.
Okay, 1, 2, 3.
Sharp.
Okay, 1, 2, 3.
Dull.
All right, 1, 2, 3.
Sharp.
Okay, 1, 2, 3.
Dull.
1, 2, 3.
Sharp.
1, 2, 3.
Dull.
Okay, both her upper extremities, both proximal and distal, shows no loss of sensory. Now I'm going to do her lower extremities. Are you ready? 1, 2, 3.
Sharp.
1, 2, 3.
Dull.
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 Okay, she had a little problem on this leg, but I think after much review, she was able to determine sharp and dull with no loss of sensory. Now I'm going to grab your great toe and try and check your ability, your perception. Okay, so of course you don't have any shoes on, and we're separating your great toe from your little toes. We're going to wiggle, 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 wiggle. Is your toe up or down?
Up.
Is your toe up or down?
Down.
Okay, excellent. Patient's sense of position is intact. Now I'm going to do some more discriminating and stuff. So first off, close your eyes. Keep them closed. It's a secret. Let me see your hand. What's that?
Tape.
Excellent. Keep your eyes closed. What's in this other hand?
Alcohol swab.
Fantastic. Patient is able to determine object stereogenesis. People. Now I'm going to draw a number in your hand, and I want you to tell me what it is.
3.
Excellent. Let me see your other hand. Ready?
4.
Okay, patient is able to discriminate numbers. Now I'm going to do some poking, and I want you to tell me if I'm doing 2 or 1. Are you ready?
2. 1. 2. 2. 1.
Okay. The patient is being able to discriminate 3 centimeters on her finger pad with her eyes closed. Okay, and the last thing I've got here is I'm going to touch parts of your face, and I want you to tell me what I'm touching. Close your eyes tightly, please.
My temple. My cheek. My chin. Forehead.
My patient is able to identify localized points accurately. Now quickly I'm going to do your tendon reflex. First we're going to do your bicep tendon. Please relax your arm, ma'am. Relax it, relax it. Good. Let's see this arm. Okay, her bicep muscle contracts appropriately. Now we're going to do her tricep. Okay, her tricep. Let's see this arm. Okay, her tricep muscles contracting, extending out. Now we're going to do her brachioradialis, okay? Good. Relax, just relax. Okay, excellent. The patient was flexing her arms and doing a supination appropriately. Now I'm gonna whack your knee and I want you just to relax, relax, relax. Okay, good. Excuse me, ma'am, I apologize. Excellent, I can feel her quadriceps contracting while I strike her knee. Now I'm gonna do some, can you cross your leg, please? Thank you. Okay, other leg, please. Thank you. Okay, I'm a little bit concerned she might have a hyperreaction with her plantar flexion. So I'm going to go ahead and do the plantar response. Okay, ma'am, can you please just relax, relax, relax. Okay, the dorsiflex ankle is not reacting. Relax, relax. Okay, excellent. Thank you. Done.